Atamari e, mōrena, tēnā koutou katoa e te iwi e te wānau. Koutou ku ono mai ki te mātakitaki i tēnei pāpā o tanga mataora. Tēnei te mea atu kia koutou katoa. Kia koutou kua hono mai mā te rewirirangi o te korimaku o Taranaki i tēnei ata. Tēnā koutou tātou tai. So those of our wānau who are joining us right now on the Ware Kōrero app or on the radio on Te Korimaku o Taranaki 94.8 FM and 98.4 FM. Tēnā koutou katoa. And to those of you who will join us on the Te Korimaku o Taranaki Facebook pages for breakfast and our main page, Mōrena, Atamari e kia koutou. Joining me this morning, I'm very honoured to have the fabulous and lovely Polly Catlin-Maybury from the Taranaki District Health Board. Polly is the communications lead for the Taranaki COVID-19 vaccination program, and she is going to share with us some very important information. Mōrena, Polly.
Morena,
good morning.
Morena. How are we this morning?
Fabulous. Why not? Hey, we're
Always.
fabulous. We're here.
We're in Taranaki. We're here. It's awesome.
Yeah, Polly, how has it been for you? Before we go into our kōrero about the vaccination rollout, how has your lockdown been? How has it been? Because you're a very important, you have a huge role.
It's been really, really busy. Believe it or not. Yeah, it's been really busy. It's actually, in a funny kind of way, it's a real opportunity for us as a program, because a lot of the places where we would like to have run clinics generally are being used for other things, but in lockdown they're not. So it's giving us real opportunities to be able to get out there and do heaps of vaccinations. So that's just, it's great, but it does mean it's very busy.
I could imagine. Yes. Have you got a full house for your lockdown? Because are you at home or you've got to go to work?
No, my tamariki are with their father this week, so it's just me and my animals this week. So I have cows and pigs and dogs and chickens and sheep and all sorts. But next week my babies come back to me, so that's awesome.
Oh, fabulous, Polly. Awesome. Now, Polly, your role is huge, and this is a really important kōrero that you and I are about to have with regards to the vaccinations. I suppose the first important question is, how can our people register for their vaccinations?
Okay, so the way it works is that we have vaccination clinics. And you go on to bookmyvaccine.nz, which is online, and you answer the questions, put in your location, and your nearest clinic will come up, so you can choose. So if you're in New Plymouth, you put in New Plymouth. You have our new main vaccination centre in New Plymouth, or Whitehaven Pharmacy are currently doing public bookings, so you can book into that. But we also have these special clinics, one-off clinics, and we have a huge one this weekend. We are doing over 5,000 people this weekend. These are the essential workers, people who are out there on the front line during the lockdown, people who are on the front line of healthcare, so people in rest homes, people going into homes and doing cares, people who are looking after other people. So if you have an elderly person at home, you are essential because you need to look after them. So you can book into these clinics this weekend. To do that, you need an access code, and your employer should give you that. If you are self-employed, then you can contact us at covid.vac, VAC, inquiries@tdhb.org.nz, and we can send you all the details.
Awesome. Thank you, Polly. Does the vaccination, does this protect against the Delta strain?
Yes, it does. So the vaccination you receive is against COVID-19, all the strains of COVID-19. Now, it's important to note that vaccinations in themselves don't stop you contracting the virus. You can still get it, but it's a very different reaction from your body if you've had the vaccination. If you haven't, you are highly likely to need hospitalization, and particularly in Maori, sadly, you are one of the highest risk groups for hospitalization and death. If you have the vaccination, you are 95% covered not going into hospital. What you get if you've had the vaccination is, it's not nice. You get sick, you feel like crap for a few weeks, but the symptoms are so much less, and it is so worth getting you and your whole whānau vaccinated, because it really, really does save lives. It really does save lives.
Thank you so much, Polly. That's really important information. And thank you for sharing that with our people as well. You touched on who the essential workers are. And I would like to ask you, who are you particularly trying to target at this time? And does it also include their whānau, so people who are living in their bubbles or their flatmates, lodges, etc.? Can they also be vaccinated with essential workers?
Absolutely. So the people that we are trying to reach out to for this clinic particularly is those who are still working in a public facing role during the lockdown. Okay, so if you are going to work with people outside your household bubble, then we need you to get vaccinated. So it's those people primarily. But you can also bring all your whānau, your household bubbles. So if you have boarders, if you have housemates, your whānau, anyone in your bubble. So if you live in a house with someone, but you also have a bubble with another home, they count as your bubble. So you can book them in for their vaccination as well. Now, it is really, 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 I can't stress this enough, important that everybody coming to receive their vaccination has an appointment. With the demand for this clinic has been absolutely massive. So we released notice about it on Wednesday, I believe. And as of this morning, everything was fully booked. But we have opened up more slots. But it means that we are not taking walk-ins. We are not taking walk-ins at all. We are keeping those slots for people who have appointments so that we can be sure that we can vaccinate as many people as possible. So as of this morning, there are 700 slots available for tomorrow's clinic in New Plymouth. We have 500 slots available on Saturday for people to come in to New Plymouth, and there's 800 slots available in Hāwera. But they will go really fast, I'm sure. But it's really important to know that everybody who comes, even children's age 7 to 12, even to 15, 7, I don't know where that came from, 12 to 15, they need an appointment. You can't put two people on one appointment. One appointment means one vaccine.
Thank you, Polly. That was really important information. How many people, to your knowledge, have been vaccinated to date by the Taranaki District Health Board so far?
Okay, so the total, we have smashed out giving 50,000 doses of the COVID-19 vaccine to people living in Taranaki. So 50,000 doses have been administered. The way that breaks down is that over 35,000 people have received at least one dose. And it's important to note that one dose still gives you protection. So the more people we can get one dose into, the better. And then people who've received both doses, so they've had total protection, is just over 18,000. Our total of Maori who've received doses of vaccine is 4,500 who have received at least one. First dose is just over 3,000, and both is 1,500. So as you can see, we've got some way to go to catch up those Maori rates. However, it's important to note that we've been working as a DHB very closely with our partner providers, Te Hāwera, Ngāti Ruanui, and Ngaruahine. Sorry, my pronunciation is awful. To support them into how they want to lead the rollout of vaccinations to the Maori population. It's really important that they take the lead, and we've taken that approach from the start. So there are lots of clinics been going on. There's pop-ups happening. Te Hāwera were out at Mokau. They've been down at Opunaki, all over doing clinics. And although, again, the rates are low, it's really important to note that so far we've been working through the age groups, and we have smaller numbers of Maori in those older age groups. So you wouldn't have expected the rates to be high in comparison to the general population, if that makes sense. As we go through to the younger age groups, our expectation is those rates will rise. But it's really important that those younger people get the vaccination. It's really important that they get that vaccination, because they are the bulk of the population. The more they get, the more protection we give to everybody. Do it for yourself, do it for your whānau, do it for your iwi, do it for everybody.
Kia ora. Thank you, Polly. Why do you think the Taranaki regional rates, in terms of whānau here in Taranaki receiving the vaccination, why do you think it's so low here in Taranaki?
Do you mean generally speaking, overall? Yes.
Ana.
Okay, so initially, when the program first started, we were asked, as you can imagine, when that program first started, it was a very big response. And as generally a program of this size, you'd be looking at like 2 or 3 years planning to make sure that it all went out smoothly. We got everybody, but we didn't have that time. We were vaccinating border workers, and we needed to set targets going forward. How were we going to go everybody? So we set achievable targets we knew with the current workforce at the time that we could achieve. We knew that we were going to ramp up as we got more people on board, as we found locations. We knew we were going to ramp up. Unfortunately, what happened was that because the vaccine supply was limited, we couldn't ramp up as we wished. So we had to stay at the initial targets we set, and they were low. And that's why we were behind. And unfortunately, in this vaccine race that we've got going on, once you start off behind, it is not possible to catch up, because there are only so many that you can do in any one time. Vaccine supply is a big reason behind why we do the numbers we do. We have to be sure of the vaccine supply. It's all very well saying we can vaccinate 20,000 people a week, but if we don't have the vaccine supply from the government, we can't do it. And those vaccine supplies have to go around the whole country. So there is a limitation there. But we are ramping up. We are doing 7,000 a week at the moment. Over the next couple of weeks, we're going to be ramping up to 10,000 a week. We are doing these mass clinics, which are getting huge numbers of people through. For a fairly small region, doing 5,000 people, we did this weekend. We did over 2,500 a couple of weekends ago in Stratford. We did another nearly 2,000 in Stratford last weekend. So you can see we are getting through them. What is also happening is that more and more GPs, we can't do all the vaccinations as a program on our own. We only have a workforce the size it is, and we only have the space the size it is. So partner providers are a really important part of our program delivery, and they always have been. We are onboarding GB clinics and pharmacies as fast as we can. We've got Waitara Pharmacy are doing public vaccinations at the moment, and Care First GPs are vaccinating their enrolled population, right? More general public vaccine clinics are coming on board with pharmacies. They should have been up and running already, but COVID hit. So we were supposed to be onboarding a lot of pharmacies last week, but then everything shut down because of the lockdown. So it's got delayed. From next week, those clinics will be up and running. More GP clinics will be on board, vaccinating their enrolled populations. So if your GP is running clinics, you will be contacted by them to tell you how to book into those clinics. The public clinics will become available on the Book My Vaccine booking online app. So when you go on to that, online on the internet, if you go online to that and you put in your area, it will come up with all the public available clinics. So at the moment, you'll get New Plymouth, Hāwera and Waitara Pharmacy. Next week, you will have a whole list. There's, I think off the top of my head, there's six more pharmacies coming on. So there will be a lot more capacity within the program and a lot more opportunities for people to receive their vaccine locally in places that they can get to very easily.
Kapwai. Thank you, Polly. Some great information there that you just shared with us all as well, e te wano. I hope that you heard those details. We will post up links as well in the comment section of this interview. Polly, some questions. I do have one more question to ask you with regards to things that we really would like to know in terms of the TDHB. Hami, I just want to acknowledge you as well. Tēnā te mihi atu ki a koe, Hami, and also Turangi Pai, who have written in some questions. Thank you so much. I promise you we'll get to your questions shortly as well. Now, Polly, in terms of the Taranaki District Health Board, how are you all trying to close the gap between Māori and non-Māori receiving the vaccination?
We're working very closely with our Māori partner providers. So Ngāti Rōrewhenui, Te Hāwera, we're working really closely with them so that they can tell us what is the best way of delivering those vaccines to Māori. So our clinics are open to everybody. We welcome you. We welcome you. Please come, please come. But we do know that there are other methods of reaching you guys. And the best way to tell us the way to do that is you guys. So we are working really closely with them to identify opportunities where we can run vaccine clinics. Moving forward, I am hoping that we can do clinics in Marae. I'm hoping that we can get round to our rural populations. We do have a rural outreach program planned, which is coming online very soon, and people will hear about that. So we will come to you. But yes, we are working really, really hard to close that gap. But we do have appointments available now. We have appointments available now. Please come. Please come. Hello, Mai. Please come and be vaccinated.
You really do? Because I tried to get an appointment the other day, but I have to wait until the end of September. So for us Māori that are trying to get vaccinations. Sorry?
So we are booking out from 6 to 8 weeks from the time of booking at the moment because of the capacity that we have in our vaccination centres. And that's why. And that's something we knew would happen when that group for everybody on board opened up, because it's just, we have limited capacity. We can't do the whole of Taranaki all at the same time, much as we'd love to. So yes, we are booking out 6 to 8 weeks in advance, but keep your eye on the news and on the updates for these one-off clinics, pop-up clinics that are happening. There are opportunities there. And also, as I said, we have more partner providers coming online. If you have an existing booking that's later on, end of September, and you see that a new provider's come on, you can move the booking. You don't have to stick to that one. You can move to an earlier opportunity if there is one there for you. And you do that through the booking link that comes in your confirmation. So as more people, don't feel that people are nipping in front of you, as more clinics come on, you can move your booking. So there is that flexibility within the system. It's merely about building capacity. It really is. And we've been working really, really hard to do that. But we have to be sure, if we're bringing partner providers on board, that we can supply them with the vaccine to do the vaccinations. There would be no point onboarding everybody and they're saying, well, actually, we haven't got any vaccine for you this week, and everybody has to shut down, because it's just not effective rollout. It just doesn't work. So that, and also the process of getting people on board, we have to make sure that delivery of these vaccines is safe for the people we're giving them to. And that means making sure that all the people who are offering vaccinations have the right storage conditions for the vaccine, are fully trained in what they do, that we can check that the flow is going to be right, that the observation is going to be right, that nobody's put under any risk when they come to receive a vaccine from them. So there's a lot of work involved in that behind the scenes. But all that work is coming to fruition next week. So there will be an announcement from us when those pharmacies and GP clinics come on board. We will be shouting it from the rooftops so that you can go and book.
Fabulous. Thank you so much. Polly, now coming now to Hami, who is actually listening in over in Brisbane in Australia. Tēnā koe, Hami. Thank you so much thank you for your wonderful kōrero and for your awesome comments as well, Hami. We see you and we're grateful. Thank you. Now he's asking, we here in Brisbane, Australia, what would you say to Māori who are or who choose not to have the vaccination, the shot? What would you say to them, Polly?
Look, ultimately, it comes down to personal choice. I would just make sure, what I would say is make sure you are making that choice for all the right reasons. Do your research. There is lots of misinformation on the internet at the moment. There are lots of people quoting scientific studies, quoting this research, saying this person says that. And, some of that is correct information and some of that is not correct information. Make sure your sources are right, that you're reading the information from. Make sure that you read the information from the government, from your health boards, so that you can make an informed choice. Ultimately, I believe that vaccination is the best protection. It's absolutely the best protection against COVID-19. I've had both my doses because I am on the front line. I had very few side effects. I think I felt a bit achy and tired the next day, but to be honest, I feel like that most days. I'm getting old. And I really honestly believe that vaccination is the best way forward. But you make your choice for you, for your whānau, for your community, and make the best choice for you.
Ka pai. Thank you, Polly. Hami, I hope that you heard the answer, the reply from Polly. Rangi pai, tēnā koe, rangi pai. I hope you and your wānau are well as well. Now she's asking, kia ora Polly, my partner is an essential worker. He received his code and is booked in to get the vaccine on Saturday coming. I've tried to reschedule my appointment, but I can't seem to add to the same location. So it looks like Rangi Pai is wanting, and you and I touched on this at the start of our interview, around essential workers and their people who are living with them, flatmates, etc., and partners. Are we able to get vaccinated as well?
You are. Now, so the way the system works is that there are different sorts of clinics. Okay, so you have your open public clinics, which when you go on, you put in location, those are the clinics that come up. Okay. You have closed public clinics. So those are the clinics that maybe the GPs run. So with those clinics, they're only for their enrolled population. So they send an access code to their enrolled population. When they put that access code in, those clinics open up. And then you have our special clinics like the pop-up one this weekend, which has an access code again, so that we can make sure that the people that need to be vaccinated get vaccinated. If it was open to the public, anybody would be able to book in, right? The way the system works is you can move your booking between public clinics or between GP clinics or between special clinics, but you can't move a public clinic, an appointment from a public clinic into a special clinic. So what you need to do is cancel your public appointment and then rebook using the code into the special clinic. Does that make sense? Right. So if you did not put in, you can't move. If you've used an access code to book into a clinic, you can't move outside that clinic. But if you cancel that appointment, put in the new access code, which gives you access to the special clinic, you can. You have to cancel your booking first and then move it.
Thank you. That was very helpful, because I was wondering the same thing.
It can be a bit confusing if you know, I'm in it the whole time, so I understand how it works, and I do understand it's confusing, but that's just the way that the online booking tool works, so that we can specify who comes to some clinics, and it's important to be able to do that, because we've been following the sequencing framework the whole time to make sure that our most high risk members of our community can get access before people of lesser risk, if you like.
Absolutely. Oh yes, Rangi Pai was very happy with the answer. Thanks.
Excellent. Good job, Rangi Pai. Hopefully we'll see you over the weekend.
I'm thinking of doing that too, Rangi Pai.
Go for it.
We've got...
Be quick, because there's not many slots left.
Right. So in terms of this this weekend and the big rollout that is happening this weekend, I believe at the TSB Stadium.
Yes. So the clinic is in New Plymouth at the TSB Stadium on Friday and Saturday, and then there is a clinic in Hāwera at the TSB Hub on Sunday.
Is it going, like, considering the fact that we're waiting for the PM's announcement tomorrow to come, is it going to be, in terms of, you know, lots of people coming together in one space, is it going to be all good with whānau that are sitting on the fence going, oh, don't really want to go there because there might be too many people, you know, lots that sort of thing, Polly?
This is why it is so important that everybody who comes has a booked appointment. We are managing the facilities so that the social distancing is observed. You must wear a mask at all times. And we ask you to please, if we ask you to sanitize, or we ask you to keep space, or we ask you to do something, please do that, because it is all about keeping everybody safe while we give you your vaccination. Do not turn up too early for your appointment. 10 minutes is fine. Otherwise, we end up with big queues and big groups of people hanging around outside the venue waiting to come in. If you turn up 10 minutes before, then we just have the people in those time slots we put you through, and the queues don't build up. It's people turning up early that create the queues. Leave all small children, Tamariki, at home. If they do not have an appointment, please do not bring them, because we are trying to keep the number of people. We have to keep the number of people inside the facility to a minimum. And by bringing your children, you are potentially putting them at risk. I know that can be difficult for families, but what I would suggest is that one caregiver books their appointment a good hour before the second one, and then you tag team the kids. It's the best way to keep everybody safe. It really is. We will not be allowing walk-in appointments, so we can track and trace everybody. We are doing this in the safest way possible. And if you are essential workers, you are out on the front line anyway. You are out there public facing anyway. So with a vaccine on board, that gives you much more protection.
What a fantastic answer. Thank you so much, Polly, for sharing that.
All right.
Polly Nahami is asking another question here. Do you think that Māori are scared because of dying, because of the risks? We've heard a lot of kōrero about this as well. Because a lot are moving home because of that reason, and in order to go home to Aotearoa, we have to have a passport shot. So I think Hami's writing this question from the perspective of Māori, Māori in general, but also Māori living over in Australia.
Okay,
do you
so
about
do you
that,
think Māori are too scared because of dying? Do you mean from receiving the vaccination?
Perhaps, yes. I think
Okay.
that's what
so
he is asking.
Let's talk a little bit about the adverse effects from receiving the vaccination. Yes, some people do have adverse effects from the vaccine, but the rate of those adverse effects have been very small. When you look at the number of people we've vaccinated compared to the adverse effects, and I'm sorry, I don't have the numbers in front of me and I'm not going to guess them, they're very small. Personally, I work in the clinic, and we have had a few people, but we have given over 50,000 doses, and nobody has died as a result of the vaccine itself in Taranaki. Okay. You can look at all the information. Again, please check that the source of your information is right. There are lots of information out there about people who receive the vaccination and 2 hours later they drop dead. Just have a look at that and see what was the reason for death. Because it may just be a coincidence. If you're 90, it may well be that the chances of you having an unexpected heart attack and dying are fairly high. And the fact that it came after your vaccination may have just been a coincidence. I'm not going to make the call whether it was or wasn't, but just please check the details of it. If you do suffer an adverse effect, we have all the healthcare at the clinics. You have to wait for 15 minutes after you've received your vaccination so we can make sure you're going to be okay. Most people experience nothing at all. I got a sore arm and I felt a bit poorly. My 16-year-old daughter has had her first dose, and she was absolutely fine. She was just really tired the next day and didn't get out of bed. Is that due to the vaccine or because she's a teenager? You be the one to judge on that one. Was she just taking advantage? All the people I know who've received it have not had adverse effects at all. But if you do, we have the ambulance service on hand. We are in a clinic where you have registered nurses everywhere. You are in the best place. If you're going to have an adverse reaction, I tell you, you are in the best place, and we will take care of you. We will take care of you. Yes, there is a risk, but the risk of contracting COVID-19 and having to be hospitalized because of the results of contracting that virus, I would say, are much higher. Please get vaccinated. Please don't let fear of the unknown stop you. Do your research and make your choice for the right reasons, for yourself, for your family, and for your community.
Excellent. Fabulous kōrero, Polly, and very timely as well for our whānau as they start to make those really important decisions around whether or not they will be, as well as their whānau members, going to get the vaccination.
I just want to add and remember out there that there are some people who can't receive the vaccination. They are already too sick. Maybe they're fighting cancer. Maybe they have some autoimmune disease, something like that, which means that they can't they can't be immunized. Think about babies who can't be immunized. You know, this Delta strain is starting to affect children, we're seeing on the news. So it's not that you're just doing it for yourself. You are doing it for people who can't receive that vaccination, and you are protecting them.
No, I love it. Carry on, Polly. I was loving your kōrero. I was just acknowledging Johnny.
It's just, I was
just acknowledging Johnny. He's writing in from Waiwhitu in Wellington.
I am really passionate about this, as you can tell. I am really passionate. Do your research. Look at all the things. Go onto the MedSafe website. Go onto our website. There's details there. Do the research. Don't just read the information that's being posted in comments on Facebook or on the internet, or please don't just read that and make your decision from that. Yes, read that, make an informed decision, but make sure it is an informed decision. Fabulous.
Thank you. Polly, your kōrero is just absolutely awesome and very timely. I just want to acknowledge the whānau there at Te Runanga Nui o Te Atiawa in Waiwhitu, and send you all so much love. Big, huge virtual hugs and kisses going out to you, Johnny, and all of our whānau. Love you all so much, all of our relations there in Waiwhitu. Thank you so much, Whaia Ngāpera, Whaia Lana as well, for sharing your wonderful kōrero. Now, Polly, before you go, I just wanted to ask you, now, I've been listening to some people talk about it in online platforms, etc., and people writing about it. People that were vaccinated actually were diagnosed with COVID-19 over the last couple of weeks. And that is why people are very skeptical now. Well, you know, it heightened, obviously, that was naturally going to happen, especially when you read the articles and then you hear about it on media and all this kōrero's happening, you know, all going on at the same time. People were vaccinated, received their shots, etc., but they've been diagnosed with COVID-19. What would you say to people about that?
Again, getting vaccinated does not stop you getting the virus. What it stops is you dying from the virus. So if we get everybody vaccinated, it means that if we get large numbers of people contracting the virus, hi, can you still hear me?
I can indeed.
I do apologise. I received a phone call which cut me off. Where were we? What it means is that if we get lots of people, if we get the country vaccinated, it means that people contracting the virus do not swamp our healthcare system so they can't cope. What we're seeing in other countries is healthcare systems that are desperately trying to save people's lives. People are really sick, and there are lots of them, and that's why people are dying. If you are vaccinated, you don't get that sick. You stay at home and you feel poorly and you get better. So vaccinating doesn't stop you getting the virus. It just means that you don't get it as bad. So, for example, if we look at chickenpox, now people may have seen children with chickenpox and they can get it terribly bad. It's awful for them. They're really poorly. They get lots of itchy spots, and they are horrible to be with for a good couple of weeks. I vaccinated my son. Again, I have two sons, and they hadn't had chickenpox before they went to school. So I chose to get them vaccinated for that, because as boys get older and if they contract chickenpox, there are complications. So I chose to get them vaccinated. So they are twins. They're in the same class. Chickenpox went round. One boy didn't get it at all. The other boy caught it. He had 3 spots on his whole body, and he was absolutely fine. He still stayed at home for 10 days, so he didn't pass it on, but he was absolutely fine. Other children in the class that hadn't received the vaccination were terribly poorly, and they had loads of spots, and they were miserable, the poor things. So it was a really good example of what getting vaccinated can do. It doesn't stop you getting the virus, but it does mean you aren't so sick with it, and it means it will save your life. And if you get it, you carry a less viral load, you are less likely to pass it on, so you are saving other people's lives too.
Tēnā koe, Polly Catlin-Maybury. I think that was a great place to wrap our kōrero up today as well. Thank you so much for this very important information. Very awesome kōrero that you have shared with everybody, and hopefully enlightening as well for a lot of our whānau that were wondering all of these questions. This is very timely. Polly Catlin-Maybury, who is the communications lead for the Taranaki COVID-19 vaccination program, and also the person who shares most important information about the vaccine. So I'm really grateful on behalf of Te Kurimako Taranaki that we could have you, especially because you are so well versed in vaccination and the COVID-19 vaccination, and who better to have than someone who knows the most about it here in Taranaki. So thank you so much, Polly.
It has been my absolute pleasure to come and kōrero with you all today, and I would love to come back and talk more if you wanted me to. Please make your choice, do your research, look at all the information out there, and then choose to take the vaccination. Please get vaccinated. It's the best protection we can give to everybody.
Kia ora. Tēnā koe, Polly. To all of our whānau who have sent through your messages, ngā mai inui kia koutou. We hope you are all safe and well, and following the level 4 restrictions and everything that we need to do properly. Nō reira, me no o hau maru koutou ki te āneane o koutou kāinga. Huri noa i tō tātou ne tau e ke maunga tātura ki koutou e noho rā ki ngā tōpito o te motu. Koutou o te pāpaka Māui e mihi ana ki a koutou hāmima. Koutou katoa. Ai mā ngāri ki te wā ingaru e manake e te aki a tātou katoa I tēnei wā o te au roku roku. Anō reira, ai waka kape ake, rire hau. Pai mā rire.
Pai mā rire.